What's up, everybody? It's Ro from the Day Party. First of all, thank you for joining us for Get Healthy, Stay Healthy Conversations with MetroHealth. This is a virtual event series that we are doing for the next several Thursdays to get you all the way informed on how to stay healthy. We're going to be talking to different specialists, doctors. Starting today, we're kicking it off with how to stay healthy during the pandemic. And I have with me Dr. Barry. Come on in. Hi, with internal medicine and pediatrics. Real quick, Dr. Barry, do you want to shed some light on what your role is?
Yes. So as an internal medicine and pediatric doctor, I take care of adults and kids. So pretty much take care of everybody of all ages.
Okay, perfect. So just to give you guys a quick overview of what this is all about, we've teamed up with the MetroHealth system to bring you conversations about how to stay healthy through a pandemic and just through everything that we're going through. I know everybody's lives is kind of like all over the place right now. And today we're covering the importance of staying on track with vaccinations, well-childcare visits, adult health care and wellness, and of course, Medicare Wellness Visits. So Dr. Barry, we're going to jump right into it. And we're going to talk about the question that's pretty much on everybody's mind. I know myself, I recently had a doctor's appointment. I was like, oh God, like, you know what I mean? But just for everyone else who's tuned in. And by the way, if you're watching, first of all, thank you so much for joining us. If you guys have any questions or comments throughout this entire event today, please feel free to comment, type them up, and we will make sure that we address them as soon as they come in. So go ahead and do all that. But again, Dr. Barry, hospital visits, appointments, the doctor. Is it safe to go into doctors' offices and hospitals? And then how are the doctors in hospitals and all that stuff making sure that we are safe?
So first and foremost, your healthcare, the healthcare of our community, as well as our providers, is of the utmost importance to us. That's our number one priority. Many people have put off a number of visits that may have been necessary or things that they felt, could wait a little bit longer during this COVID pandemic. And that's definitely understandable. However, hospitals and clinics are doing all kinds of safety measures to ensure that our patients are safe when they come in. For instance, if you come into any of our MetroHealth clinics, at the first entrance, you'll be greeted by some of our clinics, clinic staff, who are going to screen everyone for fever as well as any respiratory illness. So first and foremost, that happens. We are requiring all of our patients and visitors who come into our clinics to wear a mask for the entire length of their stay. If you don't have a mask, we are happy to provide one for you. In addition, we're ensuring that patients are at a safe distance from one another in the waiting rooms. So we've configured those so that there's proper social distancing between all of our chairs and where people are allowed to sit. We're disinfecting the areas thoroughly in between patient visits and often, and we're only allowing one visitor to come along with any patient. So if it's a parent coming for a child visit, we allow one parent, or if it's like an elderly patient who requires a caregiver to come with them, we're only asking that one come at that time.
Got it. And then, of course, I know from my experience, there's disinfectant everywhere. So
Yes.
that's definitely something that should make you feel a little bit more comfortable. Back to the kids. I'm a mother. I have a 2-year-old, and I actually just got a text message from the doctor saying that he was due for a checkup. And I was like, okay, here we go. So for parents like myself, we know that children tend to be asymptomatic when it comes to COVID-19, which makes parents like myself cautious, of course, when you step outside of your household, period, but to go into a doctor's office where you have other children, other parents, and doctors alike. How should parents approach yearly physicals and checkups for their children?
Well, the American Academy of Pediatrics still recommends that we stay on schedule with our kids' well-child visits. I too have a 2-year-old, so as a mother and as a pediatrician, I share your concern. But it is important for us to keep up with those visits because those visits are very important for us to track your child's health, how they're growing. It helps us to identify any early signs of things like learning disabilities or even mental distress, because kids are having a hard time with this too. It allows us to keep them on track with their vaccinations. We want to make sure our kids are staying on top of their vaccines because we don't want them to be subject to contagious diseases and things of that nature or spreading things around. It allows us to make sure that they have proper blood pressure checks, that their hearing and vision are okay. And sometimes we have in those visits, that's an opportunity for us to diagnose things like asthma or allergies or acne in our older kids, and allows us to start treatment then. So we definitely recommend that our kids stay on course with their well-child visits.
Got it. Now, I have a personal question because I was told something earlier on during the pandemic But then I've kind of observed some things just as I'm out. When it comes to our children, realistically, at what age should they be wearing a mask?
That's a great question. So I would say when your child is able and comfortable enough with keeping the mask on, I
Okay.
think there's no age that's too early per se. I mean, definitely infants and things in carriage don't necessarily need to have one on. But around 1 and 2, I think a kid can start wearing a mask, or we can start introducing it. Now, if they take it off, we don't have to make it, something burdensome for them. But because we are in a pandemic and this will probably be going on for a little while, I think it's okay to start introducing in those toddler years. And they have some of the cutest masks for kids
They do.
now. Sometimes you'll find your kid might start to see other kids wearing them and start asking to wear their own mask. So I think it's an okay idea somewhere around 2 years old, 1 to 2 years old, to start introducing the mask.
Okay, cool. Because then I was misled earlier on. I'm not going to say what I was told, but that makes me feel better because I know that he sees us wearing ours and he's like, "Mommy, mask," and he wants to put one on. But I'm like, okay, is it okay for him to? And he's not really out that much at all anyway. But for example, a doctor's appointment, I think I would want him to wear one. So it's good to know that he can.
Yes.
Let's get back to the kids and, well, you know what, not just kids, but adults, period. Just vaccinations. That's a very touchy subject. I'm sure you know. I don't know how deep you want to get into it, but I know that there's a community of people who are a little standoffish. But why are vaccinations so important, especially during a pandemic?
So vaccinations are important because we've created vaccines that can help prevent very easily contagious or communicable diseases. So things like that you don't even hear about anymore, like polio and chickenpox.
Right.
I had chickenpox. It was awful. So we don't want, our children and other people to have things like that. Measles, mumps. We have vaccines to help prevent the spread of those kinds of illnesses, and we have them for some are designated for children and some are designated for adults. And I think it's important that if someone is healthy enough to have a vaccine or be eligible for a vaccine, that we do stay up to date on those. Vaccines don't only protect the person who gets the vaccination, but it also protects people around them that may be too sick to get a vaccination. It protects them because they're not going to be exposed to some contagious disease.
Right. Okay. So vaccinations. Don't be afraid of them. Protect yourself and your loved ones. For anybody who's just not tapping into our live, first of all, thank you and welcome. This is all about get healthy, stay healthy conversations with MetroHealth. And we're here with Dr. Berry today talking about how you can stay healthy during and through a pandemic. So moving on, we're going to talk about what should adults be doing basically around this time to take care of their general health.
Okay. So just like we talked about well-child visits for kids, adults have an annual sort of physical or exam as well that we certainly recommend that they continue on to. Annual physical, especially for healthy adults who may not otherwise need to be seen, they give us an opportunity to touch base about not only healthcare things or concerns about blood pressure. It allows us to check on their weight, make sure we're staying healthy in that regard. We can also talk about things like their mood and mental health. It gives us an opportunity to talk about family history. What kinds of things do we need to be thinking about for you? If mom or dad had a heart attack at a young age, that's important for us to know. And that's important for us to talk about with our patients, our adult patients, so that we can make sure that they are minimizing their risk of having some of those same ailments. It's important for us to talk with them about their cancer screenings and their age-appropriate screenings, things like colon cancer. I know there's a lot talking about colorectal cancer now with the recent passing of Chadwick Boseman. So that's something that, is at the forefront of a lot of people's minds. So we want to make sure that people are being screened appropriately at the right age or at the right age for their risk factor. Women should be keeping up with their gynecologic screenings to make sure that, we're getting checked for cervical cancer and breast cancer. We like to check those things early when they're easier to treat. So it does become very important for our adults to keep up with their healthcare appointments, just like we want our kids to keep up with their screenings and appointments. We also check things like cholesterol. Those are factors that, are risk factors for heart disease later on in life, but we can learn a little bit early on if we start to see those numbers climbing. So it's important to get those things checked on a regular basis too.
Definitely. So if ever in doubt, if you feel like, man, it's been a minute since I went to the doctor, just go set up an appointment. It's better to be safer than sorry later. So then don't be too scared. Because seriously, I literally just had a doctor's appointment and they made sure everything was comfortable for both the staff and myself. And I mean, at least I walked out of there knowing that I was up to date on all my stuff. So don't wait, go ahead and get it done, knock it out. Don't forget, if you have comments or questions, leave them. We will make sure we address them. Moving on, how should new Medicare patients approach their visits during a pandemic?
That's a great question. So a lot of our patients that are enrolled in Medicare may have different, chronic diseases or things that make them eligible. We are still encouraging our patients to have their medical wellness visits as a new benefit for an enrollee. For their first year, you get a welcome to Medicare visit. And in that visit, it allows us to start planning for your care throughout, the next several years. And then annually, so every year after that, there's an annual wellness visit where we kind of build upon that plan. We go over things like medication. We review any worrisome things like, have you been having any falls? We screen for memory loss and things that we don't always have time for, or
Right.
we don't always do at regular appointments, but this is a special designated time to do that. Some clinics are offering these visits via telemedicine, so we can do them via video. So if someone is worried that their loved one may not be safe to go out for those visits, you can certainly call your office and see if those video visits are available. But we definitely recommend keeping up with those as well.
Definitely. All right, so it's no secret the world that we live in right now. Currently in a pandemic, obviously there's civil unrest. We have tragedy on the news, social media. We're about to get into an election in just a matter of days. A lot of things that are going on that affect us locally, nationally, physically, all that stuff. Have you guys seen just a lot more stress and mental health visits, basically? Has there been a lot more of those kind of issues?
I think so. And I think some of the reason why we're seeing more is because we are asking more. We know that there is so much, like you mentioned, civil unrest. We're in a pandemic. We've got a lot going on. 2020 has been a rough year for everyone. And so we're seeing across the board where people are having to deal with caregiver stress a little bit more because people are more isolated. Children are being homeschooled, and that's added another layer of stress for our parents. And also with our kids, they're starting to, feel the pinch of being at home during the day most of the time and not necessarily getting to interact with their friends. There are a number of people I've talked with that are expressing a little bit more anxiety than they've had before, very nervous about being around family and friends. They want to, but they don't know what the best course of action is. And then even people suffering a little bit more from depression. I'm really glad you asked that question because sometimes we, in certain communities, we may stigmatize, mental health issues and things of that nature, but we've got a lot of reasons to have some social trauma.
Yeah.
So, a lot of good reasons for us to seek help and assistance with like psychotherapy and things of that nature. We've got wonderful psychologists and psychiatrists here at MetroHealth. So I think that just talking with your provider, your primary care doctor, just letting them know what's going on, what's been going on with you and what you're dealing with, or what your child might have expressed of concern is definitely a good thing to do right now. Practicing that kind of self-care and checking in with yourself is something that you can do. It may not manifest itself as like high blood pressure or something like that for somebody, but it is something that's still very important and does shape your overall well-being. So I certainly encourage anyone who's been struggling with anxiety or depression or just feeling not like themselves lately to reach out to their primary care provider and start having that discussion for how they can get help.
Definitely, for both them and their young ones as well. And then Dr. Berry, if you don't mind, just because I know that sometimes we have people who might be watching or just in general who are, they're not that encouraged to go into a doctor's office to further that discussion. What are some things that you would recommend that they could do maybe in their home, in their own space, to kind of just help relieve some anxiety and depression?
Oh, that's a good question. So, I like to approach that from a lot of different angles. So usually what I would recommend is thinking about, who's in your social network? Who do you feel comfortable talking with? Is there someone who, is a good listening ear for you? Definitely reach out to that person. If you're feeling socially isolated, if you have access to things like video streaming, try to FaceTime with family.
Right.
Having those conversations with family and making sure that you're staying connected in that way. I'm a proponent of exercise, yoga, things of that nature. Listening to good music. If you're a spiritual person, prayer can be helpful for some people as well. But I definitely recommend self-care is of the utmost importance. If you journal, if you used to read books, if you used to do art, revisit some of those things. They can be just rejuvenating.
Right.
even in times of distress where we can't necessarily go out and see a movie, or we're leery about seeing a movie, or you've watched every movie you could possibly binge watch.
Right.
Start back at some of those habits, but just making sure that you do have someone that you can connect to, I think, is really important.
Thank you. That's great advice. I appreciate that. We got a couple of questions before we move on. So, does MetroHealth offer video or home visits, which is a great question? And also, any concerns about COVID in the upcoming flu season?
Yes. So MetroHealth does have a telehealth visits is what we call them. So that can be either a telephone visit, or that can be a visit done via video. So if you have access to like your MyChart, which, just as sort of a plug for MyChart, I definitely recommend that everyone who is capable and able and has a device, start getting linked on MyChart. It's so much more effective with making these video visits, and also getting messages directly to your primary care provider or their staff. So definitely want to make sure that you're on MyChart and you can take advantage of those video visits that way.
Okay.
Flu season is coming upon us, and we definitely recommend getting a flu shot this season. I know there are a lot of reasons why people have put them off in the past, and there's a lot of taboo about the flu shot, and you hear about people telling you all the time, oh, somebody got the flu shot and they died, or somebody got the flu shot and this happened. There are risks, of course, with anything that we take, any kind of medication or any kind of vaccine, but the flu shot has been proven to be safe and effective. And especially in this time where we are going to be indoors a lot more than we have in the past, it's going to be important not to, develop flu on top of trying to stay away from getting COVID-19, because that is still very prevalent in our community, unfortunately.
For sure. Hey, Pippa, we have a question coming in. She says, what are some good ways to get people, especially our elders, from feeling so isolated during this time?
That is a great question, Pippa. Thank you. So one thing that I recommend, or that I've had these conversations with some patients, is try to get your family members, like I mentioned before, on some kind of chat. If you can do Zoom, if they have the capability to do like a FaceTime, that's a great way to do it. Otherwise, even having some social distance visits, do some drive-bys with your grandparents.
Right.
Have them on the porch, come past and wave at them and hunk, or talk to them at a safe distance. Bring them food, bring them groceries, just little things to let them know that you're still here, you love them, you care about them. You just want to make sure that they're being safe.
Definitely. Thank you. All right. So all in all, what should people do if they want to schedule an appointment with their doctors today?
So you can go to metrohealth.org/appointments and make an appointment that way. On MyChart, if you're hooked onto MyChart, you can also schedule an appointment with your provider through MyChart. And then there's just, the old school, you can call the office and get an appointment that way too. But we definitely recommend that you make your appointment on metrohealth.org/appointments. And please, please, please don't put off any further, healthcare needs that you have, any well appointments or any vaccinations for sure at this time.
Definitely. Thank you so much, Dr. Berry. Again, get healthy, stay healthy, conversations with MetroHealth. This is something we're going to be doing for the next several Thursdays. And today was all about staying healthy during a pandemic. So thank you so much for your expertise and your knowledge and all your insight. We appreciate you. Next Thursday, our very own Bijou Star is going to be talking as well. So make sure you tap into that. But just any last comments or just some insight for those viewing right now?
Just stay healthy, take care of yourself. Please listen to the public health advice that's been out there. I know there are a lot of opinions and a lot of people are thinking a lot of things, and some people still don't believe it's true. We are still in a pandemic. So please take care of yourself and your loved ones. Be smart. Go out when you need to, but stay home when you can.
Definitely. And remember all the social distancing, the washing your hands and all that good stuff. All that stuff is still in play. So thank you to everybody who's been doing it and making sure that we're looking out for each other. Speaking of next week, that's at 7 o'clock. That's on the 24th. We're going to be right back on our Facebook and YouTube page streaming the 24th, 7 o'clock, the importance of screenings, which is all these conversations are super, super important and vital that you and your friends watch. So get your family members and your friends, make sure they set an appointment for next Thursday, 7 o'clock. We'll be right back here, giving you guys all the information on how you can stay healthy. Dr. Berry, thank you so much. We'll see you and talk to you soon, okay?
Thanks. Bye-bye.
Thank you all.